hemoglobin is just one test that's inside of a CBC. A CBC is what it stands for, complete blood count. And basically, the hemoglobin is just a part of that test, but I'm not going to talk about the complete blood count right now, but I will mention that, or actually I will go over it entirely in another video later on. But right now I'd like to just focus on hemoglobin and what it actually is. So when you're looking at your test results from the laboratory, you may see this test labeled as HGB, or even just written out as hemoglobin, but usually it's going to be the abbreviated version. The hemoglobin is responsible for transporting the oxygen and the carbon dioxide throughout your body. They're basically these little protein strands that are inside of your red blood cells, and they each have two sides to them. There's an alpha side and a beta side, or these alpha chains and beta chains, and they hold these iron hemi units. And these iron units are what attaches to the oxygen and the carbon dioxide in your body. That's how it carries it. But that's getting a little bit too deep. Basically, each one of your red blood cells has about 280 million of these little hemoglobin molecules inside of them. And so that's very efficient for transporting all of the carbon dioxide that you need to get out of your body, throughout your body, and all of the oxygen to supply each of your cells with food, more or less. Some of the most common reasons why doctors are going to be checking your hemoglobin levels are going to be in cases of anemia, or blood loss, maybe a pregnancy or a surgery of some sort, or even unexplained bleeding. Knowing the hemoglobin level in your body is useful because it kind of gives you an overview or a basic idea of the oxygen carrying capacity of each of your red blood cells. On your lab results, the hemoglobin level is generally going to be written out in grams per deciliter. For a male, the normal range is going to be somewhere between 14 and 18. For a female, somewhere between 12 and 16. The critical values, or the dangerous values, the ones you want to kind of stay away from, is anything below about 5 grams per deciliter, or anything above about 20. When your hemoglobin level is below the normal range, the condition of anemia is usually diagnosed. In conditions of severe anemia, or when the hemoglobin count is way too low, there's usually concern or cause for a transfusion, a blood transfusion. This usually isn't recommended unless the hemoglobin level is below 8. If you have decreased hemoglobin levels, your chances or your risks for things such as angina, chest pain, heart attack, or congestive heart failure, or stroke tend to increase. On the flip side, if your hemoglobin level is too high, you have what's considered thick blood. Your red blood cells might be a little bit too swollen there. You might have too many of them, which in this case can lead to a lot of pressure on your system, a lot of strain on your heart and your other organs, and can eventually lead to a lot of organ failure. So you want to keep these levels in their norms, where they should be. There are a couple of things that can affect your hemoglobin levels. First of all, it's actually the time that your blood was drawn. So if you have your blood drawn at 8 a.m. in the morning, it tends to be higher than if you had it drawn at 8 p.m. And the degree of variant there is about 1 gram per deciliter, more or less. And of course that changes, it varies for all kinds of different people. Some other things that can affect your hemoglobin levels: if you smoke, your body's actually being forced to create more hemoglobin because your hemoglobin in your red blood cells that are already there are being forced to get rid of a lot more of the carbon dioxide and a lot more of the junk out of your body from the cigarettes. And so to compensate for that, it has to have more hemoglobin to take care of the higher oxygen demands that your body needs. Another thing that can affect it is actually altitude. So if you live at a higher altitude, your hemoglobin levels tend to be increased. A lot of athletes will actually train at higher altitudes. They call it thinner air up there, and which is the actual truth. The air is thinner, and so because your body has to fight to get more air, it creates more hemoglobin to hang on to more oxygen. The more that it can grab, the better. As a note to all my phlebotomist friends out there, when you're drawing for a hemoglobin test specifically, you want to make sure that you're drawing this in a plasma collection tube, or a tube that contains EDTA, which is the ethylenediamine tetroacetic acid, which is quite a mouthful to say. But these tubes, you just got to make sure you don't hemolyze the sample and make sure that it is not clotted, or it will throw off the test results. For all my other friends out there, a couple of fun facts about hemoglobin. If you want to increase your levels of hemoglobin in your body naturally, you can do this by eating olives. Olives are a great source of iron and can actually help increase the levels of hemoglobin because, like I mentioned earlier, hemoglobin is made of iron. Another fun fact is that hemoglobin is actually what gives the blood its color. When the oxygen combines with the iron, it kind of creates that rust color, that red color as we like to call it, and there you go, you have your red blood. Some other things that you might find interesting about hemoglobin, I'm not going to go into detail here, and you can look it up on your own, do your own study, Google it. Sickle cell disease is actually very strongly linked, basically entirely linked with hemoglobin. It's just a deformed form of hemoglobin which causes the red blood cells to break apart or to not form properly. So look that up sometime. A couple of the tests that kind of go hand in hand with the hemoglobin test are going to be things like your hematocrit or your hemoglobin A1C. And I'll be doing videos about both of these later, and you can look into that. I'll probably be putting links up, so click on the links if you're interested. Well, that's all the time I have for today. I hope you enjoyed watching this video about hemoglobin.